I want you to stay on for me because the year is going to be very busy for you. There are cases of COVID-19 that we're hearing of, and that obviously will have something to do with your group as well. Because what we know is that the Ministry of Foreign Affairs and Regional Integration is warning against traveling to China for business or leisure in the wake of the resurgence of the COVID-19 infections in the Asian country. The press release that we have now, and you have that on your screens, gives a clear indication that, of course, Ghana has stated its position on this matter. I'll just read portions of that to you. It indicates that in view of the COVID-19 situation in China, the Ministry of Foreign Affairs and Regional Integration wishes to advise the general public to take necessary precautions when traveling to China as much as possible. Only essential travel should be undertaken until further notice. Furthermore, government has decided that with effect from Friday, the 6th of January 2023, all persons traveling from China to Ghana will now have to produce a 48-hour negative PCR test and undergo some mandatory antigen testing at the point of entry, free of charge until further notice. So that's the directive coming through from the Ministry of Foreign Affairs and Regional Integration. Let me start off with you, Dr. Tanchus Bayer. The Ghana Medical Association, the Ghana Health Service, together with KIA, have revised the protocols at the airport. What's the concern of the Medical Association going into this wave of infections again, starting from China?
All right. I think the first thing will be to advise the Ghanaian public, the traveling public, to try and adhere to these advice and directives from both institutions, the Ghana Health Service and the Ministry of Foreign Affairs. There is a real challenge. There's the data that suggests that the cases are increasing in China, and as a country, we have some risk because our vaccine uptake rate is not 100%. We've been trying to improve this, and we hope that it will improve. Until such a time, we would advise that people really listen to this advice. What is the science behind this? There is COVID in Ghana as we speak. Right. So it's not like we are trying to prevent COVID from coming into Ghana in totality. But we are trying to minimize the re-importation of this. You can't have a foolproof system, but at least you can minimize it. So to the extent that we have seen the wave that is going on in China, if you don't really need to travel there, I don't think you should go. And then this travel advice is complementary to the one issued by the Ghana Health Service, because and the KIA, if you look at the requirement for people coming from China, it's a bit stiffer. They have to produce a negative PCR test within 48 hours. There is mandatory testing for unvaccinated persons and all of that, just to make sure that we minimize. The emphasis is minimized. You cannot eliminate completely that we will not re-import, but just to minimize. As long as people are still moving up and down, the risk of transmission of this virus across borders is real. And coming along with that risk will be different variants that may come up. And if you have a susceptible population where a significant proportion of the population remains unvaccinated, then you ought to be careful. So I think it's a precautionary measure, and I would ask that the system, all of us support it. The testing, for instance, is free of charge if you come in. So there is no burden even on the traveler that is being tested. But at least if you can identify people and isolate them, they will minimize the spread within the community. So it's very commendable, and the Medical Association commends it.
There are questions as to the differences and nuances in the antigen PCR 48-hour test. What's the technical explanation to that?
Okay, so the antigen test will be testing for the viral antigens or response to the virus, which will mean that if you get the virus and you have not produced, we will need to test the antigen of the virus. The PCR is the most superior, but depending on how the test is organized, the antigen test is also very useful if it is organized in a particular way. We have a lateral flow testing system, and then we have the on-the-spot antigen test, which are the rapid antigen tests. So depending on what is being done, it is effective to be able to identify people who are carrying this virus. The PCR is as effective and the reason why they play the cap of 48 hours positive PCR, because if you did a PCR very long time ago, it's no longer very relevant. And so it is very useful within that short period for us to know whether currently you have an active infection or not. Somebody may have an infection, but the antigen test may also still be negative. So it's a multiplicity of factors just to make sure that we minimize to the barest minimum the risk of reimportation.
But are you confident? Are you confident of the measures?
Oh, I'm very confident of the measures. I think for now, per the science available, these are the most appropriate measures that can be instituted. We couldn't have gone for anything more or less. But I do know that epidemiologists, biologists, and experts are reviewing this situation. And when it becomes necessary, we would revise the terms. I know people from the Asian countries are complaining of discrimination when the West decided to introduce this kind of travel restrictions. But really, you look at your population and you take the decisions that best suit your population. If we had a country that is 100% vaccinated, we could have decided to act otherwise. But looking at our vaccine uptake rates, I think the best decision has been made for the country as of now.
The very final question I would want to ask you would be about the nose mask, but let me hear from David. David, you are health workers as well. As nurses, you'll be dealing with patients. What's your concern knowing that, of course, you have to be on guard in the wake of another wave of infection that's rising from China?
Right, you know, I mean, health workers generally and nurses and midwives in particular bear the brunt of some of these things when it's rear its ugly heads. And the increased positivity test among travelers from China justifies whatever measures that are being put in place currently by Ghana Health Service. And I need to commend them. So what we need to do is that locally we need to also try and reignite the various preventive measures that helped us to deal with the disease. So measures that were not to the benefit of our people should be upheld. As far as I'm concerned, the Asian people can say whatever they want, but looking at, as Dr. Titus alluded to, our level of vaccination is very low. So we need to encourage our people to also take the vaccination seriously. I mean, by the grace of God, we have availability of the vaccines, and they should try as much as possible to get vaccinated. Those who are partially vaccinated must get fully vaccinated, and those who are even fully vaccinated must go on to grab their booster if need be. And as I said, the preventive measures, distance, social distancing, washing of hands, and all those things must be started now. We shouldn't wait until the disease starts spreading. That's what I would say for now.
Should we be going back to the use of the nose mask? I'll start off with you, David.
Well, I think that we have experts, and as they review the situation on the ground, they might tighten the measures as may deem fit. So for now, individually, we can decide to use it. I use the nose mask. When I'm moving into the crowd, I use the nose mask. So I think the responsibility is on individuals now. So I don't know whether it ought to be enforced at this stage, but if you want to prevent your family from infection, then you need to do that. So yeah, perhaps individuals must take up their own responsibility.
Safety first.
In their own hands.
David Tinkran, I'm grateful for your time here on the Pulse. Let me wrap up with you, Dr. Titus Bale, on the use of the nose mask. Of course, we had an executive instrument enforcing that. Many say we've gone past it, so no need to go back to the use of the nose mask. What's your view on that?
That it should be individualized as of now, based on the current prevalence of the disease. For instance, within the hospitals, we use them routinely. Why? Because we have very vulnerable patients who, if they are unvaccinated and get this infection, could take them to a very undesirable level. And so people with underlying medical conditions that could worsen their state should use a nose mask. If you are unvaccinated, first thing is get a jab and protect yourself. Secondly, anybody vaccinated or unvaccinated, if you are having signs of respiratory tract infection, it is still recommended to use a nose mask. I think that should be it for now. When we get to a point, because we already have community spread of this virus and the current burden is not so much, making it mandatory with an executive instrument now may not be necessary.
And the very last segment of our conversation, it may be premature, but of course it's the start of a new year. You are asking for a pay rise, and then we know your demands as well on the labor front. Are you back to those issues this year?
Yes, I mean, there were negotiations that stopped at some point, and then those negotiations need to resume. We still have not concluded negotiation on the base pay, which should have been done last year. I think that has to be done. And we are hoping that our employer, even now, more necessary now than ever, would consider the current economic conditions that we are all in and motivate the workforce to be able to increase productivity to get us out of this economic situation that we find ourselves. We have just one way out: to work harder as Ghanaians to increase our local productivity, and hopefully we are able to work our way through the current economic predicament. And that can only happen when we have a very motivated workforce. So I think government should be looking at it that way rather than that is an increase in the wage bill. If that increase is matched with productivity,
right,
it is the right way to go. Thank you.
I know what that means as a leader of a labor union,
Yeah,
but of course we'll wait to see if the fire is turned on. We'll definitely be experiencing that together.
Yeah, but I can't go without once more just telling all doctors in Ghana, it is our day. The 4th of January 1958 was when the Ghana Medical Association was founded as the foremost professional organization in this country and was inaugurated by His Excellency, the President, Prime Minister then, Dr. Kwame Nkrumah. So congratulations to all doctors. It is our day. We would work harder. And hopefully next year we have just launched an award scheme and doctors who have given up their very best will be rewarded next year. So let's all give up our best. Soon you'll be noticed and you'll be rewarded. Thank you.